Hello, my name is Rahisha Gullidge, and this is my video drawing insulin. I just got an order from the provider that he would like for me to give 4 units of regular insulin sub-Q and 8 units of NPH sub-Q in the morning before breakfast. I will gather the materials that's needed for this procedure, and then I will verify the 6 administration rights. The right dose, the right patient, the right time, the right medication, the right route, and the right documentation. And then I will go ahead and I will check the EHR and calculate, I will check the EHR and confirm that everything is correct. Again, the six rights. And then I will calculate and make sure that I have the correct dose of medication. So I will be giving 12 units, and I will be giving, the provider ordered that I will be giving 4 units of the regular, and then I'll be giving 4 units of the regular insulin and sub-Q, and I will be giving 8 units of the NPH sub-Q. Okay, so I will go ahead and I will introduce myself to the patient. Hello, my name is Rahisha Gullidge. I'm a nursing student with Nightingale College. How are you doing today? Oh, great. Can I get your name and date of birth? I will go ahead and get 2 identifiers, and I will provide privacy by closing the door and the curtain. Can I get your name and date of birth? And I will check their identifiers with their wristband. Okay, perfect. Thank you. And then I will ask the patients, do they have any known allergies? Hi, ma'am. Do you have any known allergies to food, medication, or any for seasonal? No? Okay, no allergies. Okay, the patient. Then I will go ahead and I will determine the patient's blood glucose level and when their next meal is going to be. And I'm going to go ahead and perform hand hygiene. Okay, so now I will go ahead and inform the patient. I will go ahead and inform the patient of what this visit is for, and I will discuss the insulin medication, its actions, its uses, and common side effects, and then I will list them. In addition to that, let the patient know that they might feel a slight burning or stinging and while administering the injection, and to instruct the patient to report any adverse effects, and I will list them. And then I will ask the patient if they have any questions. We'll go ahead. I perform hand hygiene, and now I will go ahead and put on clean gloves. And before I do that, I will go ahead and let the patient know. Okay, so I'm just letting you know that for today's visit, the doctor ordered for you to get 12 units of insulin, so I will be performing that procedure for you. And me and the patient discussed the list of medications, its actions, its uses, and common side effects. Also, I just want you to know that you may feel a slight burning, you may feel a stinging sensation while I'm administering the injection, okay? And please let me know of any adverse effects, and I list them for the patient. And do you have any questions? No? Okay, perfect. Okay, so I perform hand hygiene. I am putting on clean gloves. for video purpose, I will be able to put my camera down. I will then go ahead and I will check the MAR again, the EHR. I'm sorry, I will go ahead and check the EHR for the insulin to verify and just confirm the medication and its dose. I will go ahead and calculate it, and then I will also have another registered nurse come in and to check and make sure that I'm giving the right medication and the right dose and the right patient. For this video, it will be 12 units total of insulin medication. Okay. I'm going to take the Cloudy MPH and I'm going to roll it between my palms. I'm not going to shake it. I'm just going to roll it so it can mix good. Okay, so now I am going to take an alcohol pad and I'm going to clean each vial, the top. This will go to the trash. And then I will do another one separate for the other one. Okay. Also, I would like to note that I will compare the insulin label with the medication administration record. So with the EHR, I would check the expiration date on the vial. Okay. Okay. Okay, so we are good. And if it was refrigerated, I would just allow it to have room temperature. So, and this has been at room temperature. I was expecting insulin. I would look for any clumps, any type of clumping or frosting, any coloration, alteration. I will check that. And so, yeah. So then preparing the medication, I will calculate again the correct dose. Okay, so leaving the top one, I now have my syringe, leaving the top one, I need to go ahead and draw back the intermediate insulin, which is the MPH, needs to be 8 units. So we need 8 units of MPH, and that's the amount that I will draw back. So it needs to be the amount of air that I will need to draw back into the syringe, which is 8 units. So. So let's take that. Okay, so hopefully you can see that. Okay, so that is 8 units. Okay, so I will now go ahead and take the top off. Okay, and so I will go ahead and hold the needle with my dominant hand and stick it in. So I will go ahead and hold it with my dominant hand and then inject 8 units of air into the vial. And making sure that the needle is not touching the liquid, the medication, which is not. So making sure that it's not, and then I'll go ahead and inject the air. Okay. And then I'll remove that, and without aspirating, I will go ahead and now get 4 units of air. Okay, so now I have 4 units of air that I will go ahead and I will inject into the regular insulin. Okay, so now I have my 4 units of air, and I'm going to go ahead and hold it with my with my dominant hand, and then hold the insulin with my non-dominant hand. And then I will go ahead and I will insert that. I will go ahead and insert the 4 units of air into the valve with quick and fast. And then I will release it, and I will not remove it. I will then go ahead and invert it. And this is the regular insulin, so I'm going to go ahead and remove, pull back 4 units of regular insulin, 4 units. Okay, and so now we're going to go ahead to the end to insert the valve, the syringe into the valve. And this is of our MPH, of the intermediate. And I'm holding the syringe with my dominant hand. And we're going to invert it. And we're going to pull back 8 units. Of the MPH. Which is going to be a total of 12 units. Of our dose is going to be 12. So we're going to do 8 units. So we pulled back for 8 units of MPH of the intermediate, 8 units of 8 units. And we're going to pull out and we have a total of 12 units in the syringe. I have a total of 12 units. Total of 12 units. I will go ahead and tap it to remove any air bubbles, and I will do that each time that I remove the syringe. Okay, and then I will confirm the dose by comparing the EHR again, and so this is a total of 12, making sure that that I went ahead and withdraw, rechecking to verify the number of the syringe, the number of units in the syringe, which is 12 insulin that 12 units of insulin that I prepared. Then I will go ahead and I will go ahead and then I will go ahead and recap it. If I'm not doing this on the bedside by the patient, then I will go ahead and I will label this. I will label it with the patient's name and the dose. Just for safety purpose, I am going to put this back. Okay, and this will be laying on a clean area. The thing that I want to note is that when preparing the medication, insulin, make sure that you don't overdraw, and also make sure that you don't inject when preparing with more than one insulin. Also, just want to note every time you pull back, make sure that you're just verifying that you're getting 4 units of the regular insulin and 8 units of the intermediate insulin, the NPH. And then just confirming that the total is exactly of the dose, which is 12 units. Okay, so now it is ready to be administered. Thank you.